Hello, ladies and gentlemen, my friends, my supporters, everybody who've been around following the things that I've been doing. As promised, the time has come. We got the specialist here. And I want to say thank you to all of you who responded to my post on Facebook, the people who commented on the post. So today we have the specialist.
Hi.
She's a specialist on breastfeeding. So we're gonna ask her to introduce herself. Hey, thank you for coming on our platform.
Thanks
Again,
for having me.
I appreciate that you value the things that we do, which is educating our community.
Correct.
So would you present yourself maybe to everybody, all the viewers who are watching?
Sure. My name is LaQuanda Spence. I'm a nurse practitioner and an advocate for breastfeeding. Love breastfeeding, supports breastfeeding with everything that I have, and definitely looking forward to educating everyone out there about breastfeeding and the benefits of it.
Well, thank you very much. We will also, as you guys can notice, I am not in my studio today. I'm not in my office. We want to thank GANE Multi Services for allowing us to use their location to do this video. So, first of all, let's start with, why do you love the idea of breastfeeding so much? What's the reason? Why?
I think it's because it's the most natural way to feed our children. As women, we have that opportunity. We're born with that opportunity to feed our children. So I'm very strongly committed to it, educating people on it. And just the benefits that it brings, both mom and baby, are great benefits for them.
Okay. So talking about the benefits, I know it's a lot of them, but I think it's a pretty good idea to talk about some of those things, because I did a few posts that people had, different things they say about what they think about it, whether they think mothers should breastfeed their children. But why don't we talk about a few of those benefits?
Well, one of the main benefits that we look at through breastfeeding, we have benefits for both mom and baby. And the babies are basically receiving antibodies from mom in their earliest stages of life. So these antibodies are immunity that mom has built up now that she can pass on to the baby. So the risk of infections and allergies are decreased tremendously in our breastfed babies. And then when we talk about the benefits for mom, we look at postpartum depression, we look at stress, we look at even some of our cancers are decreased. Ovarian and breast cancers are decreased in our breastfeeding mothers. So, you know, those benefits are really, really great for both mom and baby. You have a bond that's like no other when you're breastfeeding your baby. Your sleep schedule is a little bit better when you're breastfeeding your baby, because you can kind of co-sleep with your baby, not getting up making formula bottles in the middle of the night. You kind of got a bottle right here that with warm milk in it, already ready and prepared for baby to just latch on. It decreases the risk of SIDS in our babies. I mean, the list goes on and on and on and on, but definitely beneficial to both mom and baby to breastfeed.
You know, there was something that you just talk about. You talk about the benefit of postpartum depression.
Right.
I know postpartum depression can be something that is very, very common, and many women are having this issue.
Right.
Now, maybe you should explain to the viewers a little bit about what the postpartum depression is, as it will be a beneficial thing for them to know what we're talking about as we talk about postpartum depression.
Well, postpartum depression is a form of depression that's usually seen in mothers post delivery. And sometimes we don't see those signs and symptoms till a few days after. Sometimes it goes a month, after the delivery. It just depends on when those hormones imbalances are identified. So that's a depression that is associated with being pregnant or after having a baby, should I say. And so we find that when we're breastfeeding, when we see the women that are breastfeeding, those risks of that specific depression is decreased tremendously, because mom is, focused on baby, and the hormone levels aren't, I guess, as high in the non-breastfeeding mom. So that level of depression is not seen as much in our breastfeeding moms.
Well, that's a very good thing, because again, for the viewers who are watching, she's also a specialist in psych health, so she does a lot of management of depression. Right. So she really knows about those health psychological issues. Right. I know we talk about depression. One of my videos, I did talk about depression a little bit, but we didn't talk a lot about postpartum depression. Now, as far as I know, in your experience on the field, you probably have met several people who had issue with or who has been breastfeeding versus people who don't breastfeed. Right. So have you encountered a lot of people telling you that those benefits, they have seen them in their babies?
Well, I have encountered several people. John doesn't know this, but I do have a postpartum background. I worked as a mother-baby postpartum nurse for about 3 years at Emory Midtown. And the breastfeeding, and I breastfed myself, so that's probably why the advocacy is so strong. And I've seen those benefits. I've heard about those benefits. I've encouraged every woman that I see to breastfeed, and when we talk, and after about 3 months of it, it's always great. I love it. Things are going well for me. Things are going well for the baby. Even when I see kids after 5 years, who's been breastfed, decreased infections, the earaches aren't there, the colds aren't there as prevalent, the behavior problems aren't there as prevalent as well. So I do run into people, quite often that tells me that these benefits are there.
Now, I know a lot of, and again, guys, the people who are watching, if you want to send a question, if you want to ask a question to the specialist, she will be more than happy to answer the question to you, for you. So I know that some of the women who are watching this video right now, their issue is, it is time consuming. It is difficult. They are busy. They want to still go out. They want to do their thing. So they felt like it is not convenient for them to do it. What is your advice for those people?
My advice is it's definitely time consuming. They are correct about that. And this will have to be a lifestyle change. Breastfeeding definitely changes, the way that we do everything. I myself was a student at a community college breastfeeding, pumping milk in between classes. I had to bring a cooler with me. So I think if it's something that you're really, really passionate about doing, and you want to do it, and you want to give your baby the best, then you can. It's definitely going to be a life-changing situation. So you're definitely going to have to look at your schedule, look at the routine. You put yourself on a routine and a schedule that works for you. But it can be done, is what I would like to encourage all women. It definitely can be done. I say even if it's just for 6 weeks, the more the better, but any amount of time that you give to breastfeed the baby is beneficial.
Okay, so I think that's a pretty good idea, because some people thinking if they breastfeed, then that prevent them from going to work, from doing a lot of things, so they can actually pump the milk and then save it for the child.
Right.
And you say sleeping. So the babies sleep more when they're breastfed. Is that right?
Well, I'm not going to say they sleep more, John. What I will say is that mom's sleep is probably not interrupted as much with the bottle making, because babies are still going to get up to eat. And especially initially, these breastfed babies do what we call cluster feeding. And they want the breast constantly. So the amount of time that she's sleeping is probably still gonna be, interrupted, but it won't be as I'm up making bottles. It'll be I'm up rolling over, giving the baby the breast, or you co-sleeping with the baby, so you can kind of just give it your breast or whatever during that time. So sleeping is still going to be interrupted with a newborn, regardless if you breastfeed or bottle feed. But you will not be up in the middle of the night making bottles.
So this is actually a great benefit.
Right.
So you don't have to be getting up as you would have if you were getting up, going to the kitchen every time, making them a bottle. So
Right.
it will be easier.
Correct.
And I think a lot of people don't realize. Again, some people think, okay, if I breastfeed, it's just gonna be a lot of issue that I have to deal with. But again, sometimes we have to look at benefits of things. So what are some of the things that are beneficial to those kids, you know?
Correct.
And I think you being how many children do you have?
I have 3.
So you have 3 kids. Did you breastfeed all your
I
children?
breastfed all 3 of them.
Okay. For how long did you breast?
1 year. 1 year for each child.
Okay.
1 year.
So talking about this, what is the usually recommended? And I know you just said that at least a few weeks would be better. You know, it's none is better than do at least a few weeks.
Right.
But what is the recommendations like as far as how long you should breastfeed?
Well, we look at it in terms of formula feeding. So on average, a baby is on formula for 1 year before they're introduced to what we call cow's milk. So normally we say if you can breastfeed your baby for a year without giving them the formula, perfect. That's beautiful. That's wonderful. But if you find that you can't do it for a year, I say anytime. 6 weeks, most women are out of work 6 weeks with the baby, just depending on what type of job they have. If they have that luxury to take that 6-week time frame off, I say at least 6 weeks while you're home with the baby, put them to the breast every feeding, and that helps out, and that's very beneficial as well. You have some cultures and some countries that go well beyond a year, so it just depends on the mom and what she wants to do, and what she's able to do.
Okay, well that's pretty good. It was a good thing that you came here to chat with us.
Thanks for having me.
We are, again, guys, as you know, our dedication is to provide as much as education to this community that we love so much. We do a lot of education about seniors, but we want to go more beyond that, because again, the young people today become seniors in the future. So we want to go beyond that and educating the population in general, bring education. If you're watching this video and you think you have good information you want to share with our viewers, you're welcome to let us know. We could also put you on a platform. It's not about me. It's not about Ms. Laquanda, but it's about us educating people.
Right.
So if you are good at something and you want to share it with the population, you think people can learn from it, please let us know. We'll be more than happy to talk to you. Again, our number is 678-696-9905. I'm part of AWC Home Care, the home care company that look out for the seniors. And this is why we're here. Ms. Laquanda, do you have any final word for the viewers, for the people who are watching this show or who will be watching later?
Definitely just want to say thanks to John for allowing me this opportunity to be here, to use this platform to be an advocate for breastfeeding. Breast milk is the best milk, and you can always visit the LaLecheLeague.com. That's a very resourceful tool. It gives a lot of information on the benefits of breastfeeding, barriers that we face with breastfeeding, and a lot of tips as well. So thanks again, John, for having me, and I hope this was informational to all of you.
I'm pretty sure it was. There's a lot of information myself. I learned a lot, especially I'm a provider, but I don't do a mother baby, so I really don't deal with I'm a family practitioner, so I still do a little bit with pregnant people, but I don't do a lot with breastfeeding and all that. So I have learned a lot from you today as well, and I'm pretty sure all our viewers have learned a lot. So guys, a favor you could do me, if you want somebody else to learn about this information, all you have to do is to go ahead and share this video. You can follow us on our YouTube channel, Twitter, Instagram, Snapchat, WhatsApp. We're on all the social media. So use the social media for a good purpose by sharing this video with as many people as you can. Like it, comment on it. Again, thank you again for taking the time to watch this video. Again, special thanks to GANE Multi Services for allowing us to use their facility to do this video. Again, thank you very, very much. We appreciate it. And we hope next time we'll be coming back with another topic.
Right.
We'll see you again.
All right.
So thank you guys. You all have a great day. And, we'll see you guys later.